Welcome to this pharmacology quiz on aminoglycosides, part of the Quick Pharmacology Revision Series. In this video, we review key drugs from this class and the infections they are used to treat, including serious gram-negative bacterial infections, sepsis, and other severe systemic infections. This quiz contains 10 recall-type multiple-choice questions designed to test your understanding of aminoglycoside pharmacology. Each question includes 5 options, followed by the correct answer and a brief explanation. After every question, the video will pause for a few seconds to allow you time to attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which statement best describes the mechanism of action of aminoglycosides at the 30S ribosomal subunit? Option A. They inhibit initiation complex and cause misreading. Option B. They inhibit peptidyl transferase activity on 50S. Option C. They block translocation on 50S ribosome. Option D. They inhibit DNA gyrase and topoisomerase 4. Option E. They inhibit folate synthesis by blocking dihydrolate reductase. The correct answer is option A. They inhibit initiation complex and cause misreading. This is because aminoglycosides bind to the 30S ribosomal subunit, disrupting the initiation complex and causing misreading of mRNA during protein synthesis. All the other options describe mechanisms belonging to different antibiotic classes such as macrolides, fluoroquinolines, or antifolate drugs. Question 2. Which aminoglycoside has the best activity against Mycobacterium tuberculosis and is used as a second-line agent? Option A. Neomycin. Option B. Gentamicin. Option C. Amikacin. Option D. Tebramycin. Option E. Streptomycin. The correct answer is option E. Streptomycin. The reason is that streptomycin was one of the first drugs used against Mycobacterium tuberculosis and remains a second-line agent for resistant tuberculosis. The other aminoglycosides listed are mainly used for gram-negative bacterial infections rather than tuberculosis therapy. Question 3. Which is the single correct statement about aminoglycosides' uptake into bacteria and oxygen dependence? Option A. They enter by passive diffusion across lipid membranes. Option B. Their uptake is impaired in anaerobic acidic environments. Option C. They are primarily bacteriostatic at therapeutic concentrations. Option D. They bind 50S and block transpeptidation reactions. Option E. They require hepatic activation to become bactericidal. The correct answer is option B. Their uptake is impaired in anaerobic acidic environments. This occurs because aminoglycoside entry into bacterial cells depends on oxygen-dependent active transport processes that function poorly in anaerobic or acidic conditions. The other options are incorrect because aminoglycosides are bactericidal drugs acting on the 30S ribosome and do not rely on passive diffusion or hepatic activation. Question 4. Which statement is incorrect regarding toxicity and risk factors for aminoglycosides? Option A. Nephrotoxicity risk increases with prolonged therapy. Option B. Ototoxicity can be irreversible and dose-related. Option C. Loop diuretics can increase ototoxicity risk. Option D. Nephrotoxicity is unrelated to trough concentrations. Option E. Neuromuscular blockade risk rises with hypocalcemia. The correct answer is option D. Nephrotoxicity is unrelated to trough concentrations. The explanation is that aminoglycoside nephrotoxicity correlates with elevated trough levels and prolonged exposure, which is why therapeutic drug monitoring is recommended. All the other options correctly describe recognized toxicities or risk factors associated with aminoglycoside therapy. Question 5. Which statement best describes the post-antibiotic effect and concentration-dependent killing of aminoglycosides? Option A. They require time above MIC for efficacy. Option B. They show concentration-dependent killing with post-effect. Option C. they display no post-effect against gram-negatives. Option D, they are antagonistic with beta-lactams in vitro. Option E, they require continuous infusion for optimal killing. The correct answer is option B, they show concentration-dependent killing with post-effect. This is because aminoglycosides produce greater bacterial killing as drug concentration increases and continue suppressing bacterial growth even after levels fall below the MIC. The other options describe characteristics typical of time-dependent antibiotics or contain statements inconsistent with aminoglycoside pharmacodynamics. Question 6. Which is the most appropriate therapeutic pairing for synergistic bactericidal activity in enterococcal endocarditis? Option A, gentamicin plus ampicillin. Option B, gentamicin plus azithromycin. Option C, amikacin plus doxycycline. Option D, tebramycin plus linezolid. Option E, streptomycin plus fluconazole. The correct answer is option A, gentamicin plus ampicillin. The explanation is that a beta-lactam such as ampicillin disrupts the bacterial cell wall, allowing gentamicin to enter more effectively and produce synergistic bactericidal activity against Enterococcus species. The other combinations lack this well-established synergistic mechanism used in endocarditis treatment. Question 7. Which aminoglycoside is most associated with vestibular toxicity compared with predominantly cochlear toxicity? Option A, amikacin. Option B, neomycin. Option C, gentamicin. Option D, kanamycin. Option E, nettlemycin. The correct answer is option C, gentamicin. This is because gentamicin is particularly known for causing vestibular toxicity affecting balance and equilibrium due to damage to the vestibular apparatus. The other aminoglycosides are more commonly associated with cochlear toxicity leading primarily to hearing impairment. Question 8. Aminoglycosides are used for several indications except which option is least appropriate as systemic therapy because of toxicity and poor absorption? Option A, neomycin. Option B, tebramycin. Option C, amikacin. Option D, gentamicin. Option E, plasmicin. The correct answer is option A, neomycin. The reason is that neomycin is highly nephrotoxic and poorly absorbed from the gastrointestinal tract, so it is mainly used topically or orally for bowel decontamination rather than systemic infections. The other listed aminoglycosides are commonly used intravenously for serious systemic bacterial infections. Question 9. For severe hospital-acquired pneumonia due to Pseudomonas aeruginosa, which statement best guides selection between tebramycin and amikacin based on class differences relevant to Pseudomonas? Option A, tebramycin is generally more active against Pseudomonas. Option B, amikacin is inactivated by most aminoglycoside enzymes. Option C, tebramycin has reliable oral absorption for systemic use. Option D, amikacin is safer in pregnancy than other aminoglycosides. Option E, tebramycin does not require renal dose adjustment. The correct answer is option A, tebramycin is generally more active against Pseudomonas. This occurs because tebramycin demonstrates particularly strong activity against Pseudomonas aeruginosa and is often preferred in infections caused by this organism. The other statements are incorrect since aminoglycosides are not reliably absorbed orally, require renal dosing adjustments, and are generally avoided during pregnancy. Question 10. For acute pyelonephritis, which single statement correctly contrasts aminoglycosides with fluoroquinolinase in clinical pharmacology and safe use? Option A, aminoglycosides are preferred for oral step-down. Option B, fluoroquinolinase lack tissue penetration in kidneys. Option C, aminoglycosides require serum level monitoring in many cases. Option D, fluoroquinolinase have no meaningful adverse effects. Option E, aminoglycosides are mainly eliminated by hepatic metabolism. The correct answer is option C, aminoglycosides require serum level monitoring in many cases. This is because aminoglycosides have a narrow therapeutic index and require monitoring of peak and trough concentrations to prevent nephrotoxicity and ototoxicity. The other statements are incorrect because fluoroquinolines have good renal penetration and aminoglycosides are primarily eliminated by renal excretion rather than hepatic metabolism. The quiz is now complete, and thank you for taking part in this aminoglycosides pharmacology challenge. Don't forget to drop your score in the comments so I can see how you performed. For deeper learning, consider reviewing trusted references such as Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. Any guideline references mentioned in this video are aligned with the BNF for safe and evidence-based pharmacotherapy. If you found this quiz helpful, be sure to subscribe for more pharmacology quizzes and learning content.